Welcome back to the show. Children and families have been impacted by an array of challenges, especially over the last 4 years. And knowing how to help kids navigate that stress can be difficult for some parents out there. We're joined live this morning by Dr. Nadine Burke-Harris, who served as California's first ever Surgeon General. She's also a pediatrician and an author. She's going to offer some tips and support to help kids manage that stress. Good morning.
Good morning.
Yes, thanks for joining us. And you wrote a book called The Deepest Well, Healing the Long-Term Effects of Childhood Trauma and Adversity. What inspired you to write this book?
Well, I was working as a pediatrician and I was seeing a lot of kids who were experiencing serious stressors, things like abuse or neglect, or growing up in a household where parents was experiencing mental health challenges or substance dependence, or where there was parental separation or divorce. And when I read the research from the CDC that these adverse childhood experiences can actually change children's developing brains, their developing hormonal system, their immune system, and increase the risk for things like asthma or diabetes or depression, and in the long run can lead to things like heart disease and cancer. It really, I just threw myself into the research about it, and I wanted to shout it from the rooftops because I think a lot of us don't know that what happens to us in childhood can actually get under our skin and change our health throughout the lifetime.
Yes, with that said then, I know it can be a tall order, but talk about some of those ways that parents can maybe prevent stress in kids and why they should take it seriously. You've heard the expression, oh, you're too young to be stressed out, but kind of talk about the importance of taking it seriously.
Well, when we talk about taking it seriously, the CDC just came out with a report in December that said the cost of adverse childhood experiences in Michigan alone is $416 billion per year. So I think that when we look at it from a systemic level, it is a big issue. But when we think about it, what that means is that there's a lot that we can do, and we have a lot of reasons. That's 416 billion reasons for us to be doing right by our kids by implementing safe, stable, and nurturing relationships and environments, which we know can interrupt the progression from early adversity to, illness and early death.
And with that said, where can people learn more information? What will they find in your book?
Yeah, so one of the most important things to recognize is that for a lot of us, our own challenges from childhood, our own adverse childhood experiences get handed down if we're not thoughtful or intentional about breaking that cycle. And so some of the things that I share in the book are ways that we can provide those safe and stable relationships, the antidote to toxic stress, that we can do things like mental health, mindfulness, exercise, nutrition, all of the ways that on an individual level that we can be part of breaking that cycle, and also recognizing how on a systematic level we need to be doing early detection and early intervention so we can prevent and heal.
Wonderful. Thank you so much for your insight. Our thanks to Dr. Nadine Burke-Harris for your time. Again, the book, The Deepest Well, Healing the Long-Term Effects of Childhood Trauma and Adversity.